So I just got the initial recap of everything that is going on for my pre-op and post-op surgery, and I feel very intimidated and afraid, but it's okay. And we're going with the flow. So gonna ask questions to the doctor and just try to be fully prepared. Following the instructions. All right, here we go.
How's it going?
Hi, how are you?
Good. So a lot of information in our paperwork. Just know that you have to memorize nothing. Okay? So we're going to keep you posted every step of the way. I really just talk mostly about kind of the first 2 or 3 days because that's kind of the most pressing. When is your surgery?
Next Thursday.
Next week. Good. So I sent your antibiotic and I sent your pain medicine to the pharmacy.
Okay.
You should be getting a little note from, I think, your CVS, correct?
I hope so. I wrote Walgreens in the most recent one, so I'll just double check wherever that went.
Yeah. So anyway, so I did send those there, but
Okay.
I'll tell you where. So how are things? No different, status quo.
Yeah, the nose
Otherwise
is
you're well.
fine. I'm
Okay.
a little bit nervous. I did
You're supposed to be.
Yeah.
Yeah, you're supposed to
Okay.
be. A little bit. It's all good. This is what we do. You're going to love my team. You're going to find that it goes really smoothly. And then we get you through the healing phase. So both Nikki and I are really good cheerleaders. If you have questions, she's got her email there. She's got a back line for you. She can call in and ask whatever needs to be asked.
Okay.
So on Wednesday, the hospital will actually call you and let you know what time you're supposed to come in. So you'll be one of 4 cases that day. You're coming from Greenport or East Marion?
East Marion.
Okay. So you'll probably won't be first case. You'll probably be second or third case, but it just depends on the ages of the folks that I'm doing that day and kind of other medical requirements. So you're otherwise a healthy lady, correct? Any medicines every day that you're taking?
I am taking vitamins and herbal supplements.
Okay. So I usually will ask you to kind of stay away from some of the herbal stuff for a week, just because sometimes it does cause bleeding issues, and we're just not clear which is which. From a vitamin perspective, as long as you're not taking extra E, then we're okay.
Okay.
So the B's, the D's, all those things are
Do you
okay.
have another
Yeah,
pen?
sure.
Thank you.
Yeah, so the B's and D's are all fine. No problem with that. And then Thursday morning, I will see you in the holding area.
Okay.
Does that work?
Yes.
Okay, good. You'll meet my whole team. We'll have you sign your permission slip at that time, which is the consent form. So it's going to be for the septum, the turb, the valve, and I think you are a concha also. Remember us talking about that little
Yes.
bone in the bubble? Okay. So that should be on there as well. Let me just reiterate which side that is for me. It's on the left side. Okay. That's probably why the septum, goes all the way over to your right, because that concha is pushing it. So we'll take half of it away. It'll allow everything to come back to middle. Still retains as a landmark for any other troubles. So then we'll go back to surgery together. They put all kinds of little monitors on you, the blood pressure cuff. They put these little compression things on your calves. It's like a spa day, except they're not doing your nails. Off to sleep you'll go. So I'll be with you the whole time, so I don't ever leave you. When you wake up, I'll be with you also, reminding you that you're going to breathe from your mouth because you'll have the little pads in your nose. So when you wake up, you'll have that little splint on the outside skin, have the 2 small pads in your nose, and you'll have a little incision on the center post. It's 5 little blue stitches. It heals really well. You'll never know I was there in about 3 weeks. You'll go to recovery. We'll start you with some ice in recovery. You'll get to wake up. When you're awake, then you go home. I will call you that night to make sure all is well. I'll get a phone number for you the Thursday morning before we go back to surgery. Okay? 3 things for the first night. And this is usually where I just end the discussion because that's all we're going to remember anyway. So 3 things. Head stays up. the ice stays on your nose, on the sides rather, kind of on either side of the nose. And then there's a little pad underneath your nose. It's called a drip pad. It's actually held in position with little things like this. So they go right, it's like a little band that goes under your nose. And then the pad is placed just on the inside of the band. So, and it just holds the gauze under the nose. She gave you some gauze to go home with, and then the hospital also gives you some gauze. And that's kind of the first night. You're going to be uncomfortable, there's no question. It's usually not a super painful night, but you feel gross. We tell you not to take the narcotic unless you absolutely have to. So I'd rather you use just the regular Tylenol, a little Benadryl, etc. I did send the narcotic in case you need it, but again, I'd rather you not. I think it just makes people unable to cope well, and then it makes it worse. Yeah. Questions so far?
So I see that these are things that are blood thinners,
Yes.
but what about CBD?
CBD should be okay.
Okay.
Yeah, it's really just the smoked marijuana for some reason that causes thinning effects. So CBD is okay with me.
So if it's edible THC, that should be fine?
I think so.
Okay.
I think so, yeah. I mean, it's never wrong to take a break.
Yeah.
You know what I mean?
But I do
don't
have
think there's an issue.
CBD for like sleep and pain
Sure.
relief, so I was planning on taking that.
Okay.
And then also another pain relief that I take is, it's like a blend of safflower extract and boswellia. Do you think that's too herbal?
I don't know. I just don't know
Okay.
enough about it.
Okay.
I would probably tell you to do the Tylenol.
Okay.
Yeah.
All right.
Just in
Normally
case.
I avoid Tylenol, but in this case it seems.
Oh, is that right?
Yeah.
Yeah, okay. I just don't want you to take the narcotic.
Yeah.
So that's going to be an alternative.
Okay.
If you can get by on a CBD oil afterwards, I'm okay with that.
Okay. Cool.
Yeah.
Cool. Awesome.
Activity levels, she explained to you, have to be pretty light. So it's a lot of common sense.
Yeah.
You don't want to hang your head down. If you're going to read your phone, you're going to have to read it up top. So you don't want this kind of stuff.
Yeah.
You know, I don't want you to sweat for a good 2 weeks. And then every time I see you, it gets easier and easier, and the breathing gets better and better. Initially, you're going to be pretty stuffed. For the probably 4 or 5 days, you'll be getting no airflow.
Yeah.
And it's just nature of the beast. It feels like a really bad cold.
Yeah.
And then all of a sudden, things start to correct themselves, and it gets better and better.
Okay, and I did notice that you wrote like a work excuse letter. How long do you advise not working?
So usually 1 week, unless
Okay.
you're like doing something manual that requires you to be super active. And then I usually ask you to stay out for 2 weeks.
Okay.
But it's up to you.
I'm a Tibetan tones player, so part of that I was planning on using for my healing, but I did want to ask you in the blood flow realm of things, since the sound does help
Increase.
the chi move with the vibrations.
Yep.
Is that something I should wait till like week
No,
2?
I think it's okay.
Okay.
I think it's okay. Yeah. Yeah.
Yeah, because that's the one thing that's helped me up until now is I have a small bowl I put on the yin tan pressure point, and it helps me get the airflow a little bit.
Yeah. Well, I'm okay with that.
Okay, cool.
Yeah. Yeah.
Beautiful.
I guess that's it.
Yeah, that's it.
Questions?
Beautiful. I did get lots of different calls from different parts of the office today, so I just want to make sure that I'm doing everything on the checklist. So this was the pre-op appointment.
Yep. The hospital should be on the phone.
Okay.
I don't think they're gonna make you come in. Have they told you that you
Well,
have to come in?
I talked to them like 5 different times today. So,
The hospital?
Yeah.
Oh, Lord.
So I'm gonna call them again tomorrow to
Okay.
do that checklist.
Oh, good.
But other than that, is there anything that should be on my radar?
Oh.
Okay, I think it was just because the appointment time got moved, so
from
people
today.
got confused.
Oh, gotcha.
Yeah.
Yeah. Were you supposed to be seen tomorrow?
Yeah.
Oh yeah, they moved. My daughter graduates.
Oh, congratulations.
Yeah, it's grad school, but all the same. So, and my flight was such that I could do my day, and now they moved it to 10:15 in the morning tomorrow.
Of course. Yeah.
Southwest.
Nature things.
I know. So yeah, so all my surgeries I did last night, today, they have to come between 7 and 8 a.m. tomorrow, which is a little earlier than usual. Oh wow.
Glad you could fit it all in.
Oh yeah,
Thank
we're gonna make
you
it
so
work.
much for your support.
Of course. So good. And if you have questions, then fire them off to Nicole, during the week or whatever, and then or we'll talk when I see you in the facility.
Perfect.
Okay?
Thank you so much.
You're welcome.
Appreciate it.
Which one didn't work? This guy?
Yes.
And then you'll grab your medicines that I sent to your pharmacy, just so that you have those on hand. I think that's it.
Cool. Thank you so much.
You're welcome.